So I've been talking more and more about how treating your metabolic health might help with your rheumatoid arthritis or other autoimmune conditions. An interesting study just got published in the ACR Open Rheumatology Journal, looking at patients with rheumatoid arthritis who had started on a GLP-1 agonist for obesity. And these are folks that are BMI greater than 27, and they were either taking semaglutide or tirzepatide. They followed this over several years, and they wanted to see how did people respond. So as expected, they had improvements in reduction in their weight, improvement in their cholesterol panel, improvement in their hemoglobin A1C, marker of diabetes. They also found was that in the cohort of people who stuck with treatment, that they had reduction in pain, reduction in their overall rheumatoid arthritis disease activity, and even reduction in their inflammation levels. So this is further evidence that there is a connection between metabolic health and inflammation. Now, this is not a study that's looking at, hey, what dose do you use to treat this? Or this is not a study that is really conclusively saying that using a GLP-1 agonist will help to reduce disease activity. This is not even a controlled study. This is not controlling what other medications they were on. This is just more evidence that GLP-1 agonists and improving metabolic health can help out with inflammatory arthritis and rheumatoid arthritis. Now, there's some other questions, meaning, is the improvement here because the GLP-1 agonists are directly doing something on the immune system and reducing inflammation? Or is it because indirectly, by improving metabolic health, it's then indirectly improving inflammation as well? Either way, it's just more evidence that there is this connection between inflammation and metabolic health, and that as you treat one, you can affect the other, whether it's treating inflammation to improve metabolic health or treating metabolic health to improve inflammation. Any way that you look at it, this is interesting and exciting stuff. For what it's worthwhile, the rheumatologists that I know are kind of chattering back and forth even before this study and asking, hey, who else is seeing that their chronic inflammatory arthritis patients, RA and psoriatic arthritis patients, seem to be getting better with their inflammation when they start GLP-1 agonists, and not like months down the line with weight loss, but even within the first few weeks. Again, I think the future of this connection between metabolic health and inflammation is going to get really, really interesting and will be a very fruitful area for how we can help patients out even more long-term.